That's good, isn't it? I mean, that's not good, but it's...
The abscess cavity that I ended up just sucking it out, ended up making an incision and just putting my hand in and breaking it all up, sucking it all out. The bowel going into that abscess cavity is this big, the bowel coming out is that big. That's this point of obstruction.
Right.
Was that abscess cavity, that twist right there. So I sucked it all out and I followed that intestine all the way back. 26 feet of it in my hands.
The part that was backed up.
26 feet. I went its entire intestine
Yeah.
from the ileocecal valve to the stomach.
And nothing.
Nothing.
Right.
Just big, big, big,
So
big. Abscess cavity, small.
So you think that diverticulitis
Perforates,
throws off
pus, infected poop.
Yeah.
He goes in, his body walls it off, he gets an abscess, and he obstructs.
Oh.
Nothing else.
So
there.
it's
So
kind
that's
of...
why it was never the small intestine, because it's actually the colon.
Really?
That's going right down, that little pus pocket hole, that hole that I followed down,
Oh, you have the picture.
the waterfall, I follow it back, it goes up underneath his sigmoid colon on the back side of his intestine.
Get out of here. That's awesome. I mean, that's
think
not
that's what it
good,
is.
but I think you...
That's what it is. And he's got terrible diverticulosis. And we knew it on the CT scan, we saw it.
You did show it to me.
See all the bubbles everywhere?
Yeah.
They're hard as a rock. They're like marbles.
Why is that?
Hundreds of them.
Why?
His diet stinks, or his
It
diet used
doesn't.
to stink.
I don't know. He never...
So he gets a colonoscopy
And
as soon
then-
as he gets out of here.
Okay.
So I didn't cut anything, didn't sew anything back together. Some of his bowel was just like big and dilated, so what I did was I like kind of pulled it together because it
Yeah.
looked like it was about ready to rupture, but there's no spillage of poop anywhere. I went through 26 feet of intestine in my hands.
Oh my
I felt
God.
his stomach, I felt his liver, I felt his colon. His
Mm-hmm.
colon is the only thing in his abdomen that's weird.
So
It's
how
bad.
do you get rid of that?
Take that little segment out that he's got
A colon?
down the road.
Oh. But in the meantime, you can
Look.
prevent these things from infect...
He gets a colonoscopy.
Right.
Let's let Tanner look at the inside. Tanner's going crazy.
Why?
He's called me 3 times.
Want to know what this is? Oh, well, that's good to know. That's got to be it.
It's got to be it.
It makes the most sense, don't you think?
The pathologist yesterday told me this is something outside, and she says this is what I see with diverticulitis.
It is outside, but because it came from the colon, right?
So I cultured everything, sent for everything we do. When everything else comes back negative, he gets a colonoscopy. And Dr. Tanner sees big, nasty diverticulum with pus coming out of the diverticulum. That's what we got.
And that can be treated? Or is that going to be
Medically,
surgery?
but 6 weeks down the road, consider getting that area out.
6 weeks?
And the first CT scan he had done showed weird colon, remember? The second one didn't. He had 2 CT scans in May.
He had one at an outpatient and one here.
And the one in outpatient's the diverticulitis, and they said, we're going to give him a colostomy bag. But then he got antibiotics as an outpatient. Then repeated the CT scan, and the diverticulitis, it didn't look like diverticulitis. There's an abscess. His colon on this one is not inflamed.
So how does the pus get out of the colon into
He's got diverticulosis. He's got diverticulitis.
his holes?
Yeah. So
Did
he's
they
got-
come out of the
So
colon?
he's got a sigmoid colon that's got diverticulosis in it. So he's got these little out pouches, these little bubbles.
Oh.
He's got hundreds of them,
And they pop,
and they pop.
and that produces all
They
that
pop,
pus?
and then you get an abscess. And then it heals it back up again.
Oh, and there's all that pus?
So he's popped. He leaks poop out. There's a piece of small intestine sitting right here. This gets better because he's on antibiotics, but there's your body walls off that piece of small intestine,
Oh.
and then his small intestine can't go around that because it's too much of a hairpin turn, and then he gets an obstruction. Then this part gets big and wide and dilated because there's a pus pocket right there. When you go in there and you're looking, he says he's got a perforated small intestine. He didn't. He had a perforated colon a week and a half earlier, 2 weeks earlier.
So smart.
So it's
He
almost
doesn't have
like
any of this stuff down here. He doesn't have anything down over on the left-hand side. Doesn't have left lower quadrant pain. Doesn't have any of that stuff. He gets a colonoscopy. I'm betting it's his colon.
Okay, well, let me take the timeline here. We've been,
Go do what you need to do.
it's
He's
6
better.
weeks away.
He's better. He's gonna
Oh,
take him
I'm
forever to
going
get better. He's gonna
out.
be here a week now because I did this.
Really?
His bowels are not gonna wake up. He's got a tube in his nose. He's gonna be bitching about his tube. His colon is this big. His small intestine is this big. It's just like a water balloon with too much water in it. I mean, I can see right through it. The wall is so thin,
Holy crap.
so it's dangerous.
Yeah.
But I mean, I didn't want to rush in and operate on him again either. But it's big.
So it's
So I
gonna
found
take-
the area where the colon was huge, where the small intestine was huge.
Mm-hmm.
Then here's a big abscess cavity, and then there it is, small on the outside. So I saw it. So here's huge, here's normal. And that's where it goes into his colon right there. So I drained all this out, and I followed it down with my finger first, and I could follow it. It's a little tunnel. I followed it. So I opened him up, and I opened up that tunnel, and I followed it down, and on the bottom of that tunnel is one of these. Way, way, way far away. This far away, down underneath everything. He's perforating diverticulum, he's walling it off, he's
Wow.
seeding
You
infection.
ever seen that before?
Yeah.
Oh,
But his CT scan says his colon was normal.
right, right. Now, his intestines being that big,
It's going to take forever for him to wake up. It's like stretching your arm too far, you can't lift anything, so the muscles of his intestine are stretched so far they can't push. So his bowels
that's
are
why he's so quiet.
his bowels are just sitting there. So all that's got to work its way through until it gets to the point where, you know, the muscles are to the point where they can start moving again. It's like overstretching your, you know, when you get to a point where you can't move because your muscles, that's what's gone on.
And so when you open that up, it just doesn't go.
Mhm.
It just,
It's like a slinky
wow,
water balloon with too much water in it. It's big and clunky, and
huh.
I can see right through it. The wall's so thin.
So it's gonna take
I can
days?
see the barium in it.
Oh my.
And
So-
it's white.
So it'll take days for that to go back?
I bet it won't even have bowel sounds for 4 days.
That means no food still.
He's gonna. Well, we're feeding him.
Yeah.
I'm glad we put the pick in.
Mm-hmm.
Because there have been 4 more days. So he's going to be pissed. He's going to be bitching about
Oh,
this.
yeah.
Oh, he'll be happy.
That's the last
Nope.
thing he said. I hope there's no
I've had one. I hate him.
Is that where they sucking everything out of his stomach?
Yeah, I bet that's what it is.
The time frame though.
Common things happen commonly.
Yeah, that's, I think you're
Just
right.
an uncommon presentation of a common thing.
Right. What I was saying, we have travel plans in about 6 weeks, but it's out of the country.
Go.
Are you sure?
Yeah.
And have it done afterwards?
Yeah.
Okay.
I mean, because it's taken almost 4 months for this to flare up again from the
And,
last
if,
incident.
and I'll give you Cipro and Flagyl to go with him your trip
Oh
with
yeah, I
you.
want something to take.
So if he gets something, he pops them.
Well, they're supposed to go to Jamaica, but I mean, worst case scenario, if something happens, they can get back
Well,
on
I've
the
had a
plane
guy
and get
fly
here
back
pretty
from
quick.
Jamaica
Yeah.
when he had diverticulitis.
Yeah, he was all worried. I said, it's a 3-hour flight.
Yeah.
You get on a plane.
I
and
wouldn't
come
have
back.
surgery down there.
Oh,
Oh,
God,
no,
I wouldn't
no,
even
he
go to
don't
the
even wanna
I
doctor.
mean,
go
if he
for it.
starts having pain and stuff like that, your plans just changed, you know. Come
Right.
home early.
Right.
And I can write letters.
Okay, you don't think we should have that colonoscopy before we go?
Yes.
Oh, okay, we do want to have it
Yes.
before we go. Okay,
So that's
but then
probably-
if we have
Well,
surgery, then we're not going to do that.
And wait till after you come back for the colonoscopy, because if he perforates during the colonoscopy, that would stink. That's what I
Then
did.
you
That's what
know.
I was doing last night.
That would stink.
That's what I was doing last night.
Really?
Yeah.
What were you doing?
Perforated colon from a colonoscopy.
Oh my God.
Not your GI doctor.
Thank God. You're fixing it.
Yeah, because he got a colonoscopy and got perforated
Oh my
during his
God.
colonoscopy.
That sucks.
I shouldn't have told you that.
I know.
Your husband to
I
get a
trust
colonoscopy.
Tanner. He's
Yeah, I would
he's
too.
a good doctor. Wow. Yeah, that's a good thing though. Just, you never know. So be safe. Just do it as soon as we get back.
I would.
Yeah.
Colonoscopy. He's worried about his mom anyway.
Oh yeah.
He's 50.
2.
He should have had one every year anyway. Should have had one when he was 50 anyway.
He did have one a little early because of his mother, but then after he had that one,
He was.
he wasn't going back.
It was 5 years ago when he did it, maybe 6.
And,
I
and,
just
and
did
Tanner
mine.
said come every 3 years because of his history. Well, I couldn't get him
He
back
needs to
in
do
here.
one.
Yeah.
Yep.
See, and probably surgery.
Yep.
Well, I definitely want to
He's
get.
proven himself that he's not going to tolerate this.
So antibiotics don't help.
Yeah,
The-
but I mean, it's going to come back. This is exactly what diverticulitis does. Every couple months, you get another attack, and then that's
So
what he did.
All you have to do is you have to remove the diverticulitis.
The worst part.
That's
The rest
right.
of his colon looks pretty good.
That's why that lady
well,
that
that's good.
over where he gets his hair cut was saying she had to go back 3 times before they fixed it. And I think that's what they did on the 3rd time is
How much colon do you have?
9 feet.
Oh, so he could. How much do you think is?
But
bad?
I would normally do these laparoscopically, and people leave the hospital in 2 days. I don't think he's going to be able to be done laparoscopically. We can try.
Really?
Because of all this pus, everything's stuck.
Oh.
We'll try.
Hmm.
We'll try. So he gets colonoscopy, make sure there's nothing anywhere in there.
Mm-hmm.
Then he rests, then he comes back and we take a little segmental resection, put him back together. That's usually, if we do it laparoscopically, we usually do it on Tuesdays to leave the hospital on Friday, so that's not that bad.
But if it's
A little
not.
teeny incision. And he's got, from his belly button down now, he's got an incision right from here to here. Bigger than before.
And if it's not laparoscopically, then it's longer.
A couple more days in the
Couple
hospital.
more days. Okay.
But laparoscopic's better.
Yeah. Yeah.
But I mean, better for me too.
Oh, okay. Well,
But if we can't, we can't.
right. When would you know that?
We try.
Oh, you just try. Okay.
And say, sorry, the
Okay.
first part, but we had to make an incision at the end.
Well,
That's what it is.